Welcome back to Today's Health. I'm talking today with Dr. McFarlane about bariatric surgery. Dr. McFarlane, what is the sleeve gastrectomy procedure?
The sleeve gastrectomy alludes to the contour of the new stomach. If we look to our diagram on our left, again, the normal stomach usually looks like a deflated football. What we then do is then contour the new stomach, which becomes really about the size of, think about your thumb, a long tube, if you will, hence the word sleeve. The excess stomach is removed, though.
And how does this procedure help someone to lose weight?
Well, it harbors an idea called restrictive obesity, where your stomach is a certain size or capacity. It's reduced by a quarter of its original size, so it's early what we call satiety or full sensation. So as a result, patients eat less.
What are the benefits to this procedure as opposed to other bariatric surgeries?
Well, for one, for the adjustable gastric band, however, the key word there is adjustable, and some people want it fixed. So this stomach size is fixed regardless of what you do, with a few exceptions. As opposed to the gastric bypass, there's an additional rearrangement of your anatomy that some patients find uncomfortable. And last but not least, a portion of your stomach is permanently removed, so this is a permanent procedure.
What are the risks and complications associated with this procedure?
Well, part of how we create the sleeve comes down to using staples. So if we look to our diagram on our left, we'll see the staple lines which come across along the length of the new stomach. Anywhere along this area, there could be a break in the seal or called leak. And the leak is what the most devastating portion that surgeons are aware of. Thank God it's very uncommon. If at best it's less than 1%.
How would a patient know if they had this leak?
Well, usually within the first 1 to 2 days of their operation, they're under very close observation. One, we look for an increase in their heart rate, which is a sign of there could be an infection, what we call a leak. The other for some is just mild, vague abdominal pain, but the highest time frame for that, usually within the first 24 to 72 hours, we're watching patients closely. Usually before they go home, we've done many myriad of studies to make sure that they're safe before they go home.
What can a patient expect for recovery after this procedure and in diet, lifestyle, that type of thing?
On average, recovery is fairly quickly. The approach is important. It's minimally invasive surgery, laparoscopic surgery, so you get the benefit of going home quicker. Some can be as short as 1 day in a hospital. The other portion is, let's say, going back to work. I've seen patients go back to work the same week. In terms of their new diet, again, early sensation, early fullness, we have to encourage patients to eat. So if we look at the palm of our hand, minus the fingers and the thumb, their new meal is no bigger than that. So for the first 2 to 3 weeks, liquid diet, then they progress more to regular food.
What are the expectations for weight loss following this procedure?
At this point, we still have a lot more research coming, but it's about to rival the more common and traditional gastric bypass. Again, that number based on what's called percent excess weight loss, how much more weight you're overweight by. It could be 60%, if not more. Providing the patients follow the rules, they'll definitely get their level of satisfaction with their weight loss.
Dr. McFarlane, this is great information. We need to take another break. We'll continue in a moment.
Thank you.